Hi, I'm Angela. I'm a fourth-year medical student at UCLA currently, and I'm going into internal medicine.
And I'm Stanley. I am currently attending at Cedars-Sinai, but was a former UCLA med student and resident here in internal medicine.
Is there any advice you would give me now at this point while I'm interviewing for residencies, and now that you've gone through residency yourself and are now an attending?
Yeah. I think something I've realized in the end, where you end up doing your training, I think for the most part, everywhere that you will go, will train you well. I think that's based off because of you as a person, you'll be able to maximize the opportunities you're given at any place you get to be able to get the learning. Some of your concerns right now is, of course, and I again felt the exact same in your position that I heard the same things from my mentors that all the places you're interviewing are great, you'll be a great doctor anywhere, but still deep down there are preferences and wanting to go one place over the other. But I think in the end, wherever you end up, I think you'll be really happy and you'll be able to, you will become a really great physician.
And so I think that's the biggest challenge right now is just not knowing where I'm going to be in 4 months.
Yeah.
And feeling kind of at a loss of control almost. And I think that's what a lot of my classmates are going through as well.
Yeah.
But definitely what you're saying makes sense. You just have to trust the process. Mm-hmm. And it definitely does seem like all these residencies have a lot to offer. And so I know in the end, the whole point is to become a doctor. And I think that will happen.
I think you've been my first, my first medical student mentor as a resident after having gone through it, and so it's really exciting to kind of see you kind of progress and kind of join us on the other side in a couple of months. So
I think just hearing your perspective, no one has the right answer. I think that's important to know is it is a hard process and we all go about it in different ways, but I think just hearing different perspectives and hearing your perspective on what you did was really useful.
Yeah. Have you, I guess, through medical school, have you had any kind of, mentees of your own, either in med school or even pre-meds that you are currently kind of helping through a similar process? And how has that been for you?
Yeah, through the Big Sib program within my college, I have a little currently, and I was definitely reminded of the things you told me when I was in her shoes. And so I think I was able to use some of the advice that you gave me, but also build on my own experiences to help answer a lot of questions that she had. Yeah. I remember a few months ago, she was a little worried about her rotation schedule. Yeah. So she asked if I could weigh in and take a look at the screenshots that she had, which I think you did for me. Yeah. And so it was kind of reminiscent of, made me think how far I've come. Yeah. And I was happy to be able to go through her schedule, kind of reassure her, and answer all the little detailed questions she had, having gone through it myself. Yeah. But ultimately kind of trying to reassure her that no matter what, it's going to be okay. Yeah. Because honestly, it really is going to be okay. And I think sometimes you just need to hear that from someone who's been through it to really believe it. I'm hoping to mentor medical students too, now that I'm mentoring residency. Yeah. So do you have advice on being a good mentor and how you can best help medical students with the knowledge that you have?
The general initial approach I've had with a lot of mentees is just getting a sense of what they need kind of help with, and then kind of tailoring that to them. But for the most part, I think the most helpful thing, like you said, has been kind of just providing your own experience, hearing someone, like you said, that has been through what they're about to go through and providing them, honestly, mostly reassurance that a lot of the things they've heard can sound really scary and daunting, but now you have someone that has gone through it and is able to tell you hey, it wasn't that bad, or oh yes, it was kind of bad, but honestly this is ways I did things to cope or whatever. Mm-hmm. So I think just providing that kind of perspective is honestly, I think, the most valuable. And I'm sure now having gone through 4 years of med school, and I'm sure once you start residency and seeing that you'll be able to give that back as well.
Sometimes mentees can be afraid to reach out to their mentor because they feel like they don't want to be a bother, or because everyone's busy, and being a resident, of course, you're very busy. But just being aware that you're always available was really helpful for me.
Yeah, no, that's a really good point, and I think that's something at every stage is really scary, like to be able to like have the accessibility and those kinds of things. And so, that's good to know.
Yeah, I mean, I'm sure I'm still gonna have a lot of questions. I'm just a person that has a lot of questions throughout the last 3 years, and I'm sure that will continue into residency and beyond. So, yeah, if you're available to help me out still, that would be very much appreciated. I mean, this is actually the first time we've ever met in person even, and we've been able to maintain such a strong mentor relationship just, through texting and like phone calls. So I feel like it doesn't matter if we're like in the same space, like if we're both at UCLA, it can continue regardless. I think it's been really great over the last few years, and I really don't think I could have gone to this point without you. So thank you.
That's super nice. Yeah, no, and I think you did so much, and I think you made me feel like helpful. Like it's great that you had a lot of questions, and I felt like I could actually provide some help and answer some of that. So the feeling's mutual for sure.